Do you know that about 17.7 million people die yearly because of cardiovascular disease? Yes, this is a study that was done by World Health Organization in 2015. And it showed that out of this 17.7 million, 7.4 million is because of myocardial infarction. And by myocardial infarction, I mean heart attack. Yes, heart attack kills so many persons yearly. Now, I want you to sit down. Let's discuss step by step on how you can handle a patient or a relative that is having an attack, and how you can prevent yourself and your relatives from having heart attack. Get a seat. Let's discuss. So heart attack is here and we must know about it. Heart attack occurs in people mostly between the ages of 25 and maybe 75. It can also occur afterwards. And we've noticed that it's commoner amongst men. It doesn't mean it doesn't happen to females, but it's commoner amongst men. And what are the symptoms you should look out for and the things that can predispose you to it? If you're someone that's already having a heart disease, that's already hypertensive, that's already having high cholesterol, you are predisposed to this. Now, the common thing we notice that can cause these things is patients that have what we call pulmonary embolism. Now, let me tell you a little about pulmonary embolism. Pulmonary embolism occurs when a blood clot flows to the heart, and what it does is most times it can flow to the lungs and it will block the heart from receiving blood supply. And when these things occur, you now notice that the person starts having a chest pain that is excruciating, and this chest pain feels like a heavy weight on the chest and is usually retroexternal. The person says, I'm having a chest pain. What you will notice is that this pain is worsened with activity and this pain is relieved with rest. Most times when these people have this, you have this breathlessness, you're panting for breath, you want oxygen, the person might even be sweating. Which people are predisposed to this pulmonary embolism? The first thing we say is DVT, deep venous thrombosis. That is someone that has a predisposition to form thrombus in the deep veins of the leg. It's commoner with people that have a long distance travel. I know you've heard stories like somebody that just traveled from abroad and came back to your country, or someone that had a long distance travel and following activity, the person dislodges a clot and the person has a heart attack. It can also occur with people that have had surgeries in the leg. Yes, and people that have been immobilized, people have not been moving, the person is bedridden for up to 1 month and the person now just wants to move about and throws up an embolus and the person has a heart attack. Or people that are pregnant, these predispositions are there. When you know this predisposition, it will not make you that when you have a relative that just had a leg surgery or a hip surgery or just traveled for long and this is a patient that is having heart disease or someone that is pregnant, is also more common among obese people. When you now know these things, you are not asking, what can I take as a prophylaxis for DVT? What can I take to prevent me from having pulmonary embolism? So you are now someone that's having a heart attack. What do we say? What are the first things we say? If you have aspirin, you give the person aspirin to chew. Yes, give the person aspirin to chew. Aspirin can easily be gotten. For the fact this person does not have a bleeding problem, give the person aspirin to chew. Why are you already making a call? The first thing you should even do is to call a doctor. But while you're doing that, you can give the person aspirin to chew. Take the person in a place that is well ventilated so that the person can be getting enough air. This is not the time to start pouring olive oil in the mouth of the person. No. It's not the time to start pouring all the water on earth on the person. No. You're already making plans to get to hospital, but aspirin, chewable aspirin can help this person. If it's someone that is already having a heart disease or someone that is already on antihypertensives, you're also checking the drugs that the doctor has already prescribed that can help this person. While you are doing this, you're already getting to the hospital. And much more than treating heart attack, you should learn how to prevent it, because we know that how heart attack occurs is when clots now go and form a plaque in the blood vessel and the person is not able to receive blood at that time. So if you are always taking things that will increase your cholesterol, you are predisposing yourself to much more harm. Another thing you can do is to watch your weight. Yes, obesity predisposes you to heart attack. There's something we call the morbid quartet. When you are having diabetes, hypertension, obesity, and high cholesterol, you are predisposed to some of these diseases. I hope this is helpful. If you found it helpful, subscribe to our channel so that you can be getting much more videos like this. Also, share with a friend so that you can save lots of persons around you. I know you wouldn't want it to be that when something is happening to you, people are snapping you or videoing you. It's better for them to know how to handle these emergencies when it occurs. Click also on the bell button so that you can get notifications whenever we release any of these emergency videos. See you in my next video. Bye.